Geez, I didn't know how to go live. This is the first time I'm going live, I think, and I had to Google it. I had to Google how to go live on Facebook. I should ask Dr. David Moffat because he goes live every day. He's the expert in going live. Alright, anyways, this is my first time going live. This is a new Dental Profit Machine neon logo. Pretty cool, I love it. And I just wanted to say that this Wednesday, I think, for the first time after 3 years, one of my old employers, dental practice owner, invited me. We're friends for years now. Invited me to go just for half a day, just bring back memories like old days, see patients, and go to the dental practice and hang around and look after patients pretty much. And I'm really excited, and because my work with dentists is mostly online and all that, and I really love dentistry, seeing so many people and patients in one day. It's just fun. I always loved it. So I'm really excited to go back, and I don't even know if this is live. Is this live? Okay. All right, fingers crossed. So yeah, go back there and see lots of patients. They're booking patients based on my schedule for one day, just to go and have fun, old memories, see 20, 30 people in one day and greet them and all that, and play around with booking systems. I really miss those days. It was really fun, and because of that, I wanted to share one tip on booking. When people come in, especially for the first time, and they have this huge treatment plan. I wanted to share my experience of what I've learned that had high conversion rate. By conversion, I mean high booking rate of people who had their initial exam, that they had this massive treatment plan, small to massive. I talk about the hardest, which is the massive ones, and how I was booking them for their next appointments with a high percentage. I mean, it was fun. I liked it. And I could see I'm helping people doing that. And how I was doing it is that, how we have 4 quadrants, whatever you call it, I don't remember now, was breaking their treatment plan to 4 different lists of top right, top left, bottom right and left, list of teeth that needed work done, and get the quotation with their insurance if they had any on the spot, and telling them, look, you can break this treatment plan to multiple appointments and do it over 3 or 4 months. And if you, for example, if you do this top right teeth for your next appointment, like in a couple of weeks, if you want to come back or something, depending on how urgent it is. If it's not a couple of weeks, book it today. It's going to be this much, and half of it or this much of it is covered by insurance, and your out of pocket for that day is going to be this much only. So that's your next appointment. And the following one you can book whenever you're ready. Again, we book you like if it's in a month or something, and your out of pocket is this much only. So breaking the treatment plan down to multiple lists in appointments, and letting them know this is how much, breaking it down, making that big, huge expense and quotation to smaller numbers, a few $100 only, and in some cases, if they have good insurance, less than $100 for the appointment. It becomes so doable and no-brainer, and it makes it so easy for the patient, and it's clear. Plan it right there for them, help them, and they were like, yeah, okay, sure, let's book it. That sounds great. And I was booking them for the next appointment. They come in next time doing the same, and they were going to check out, pay for the appointment, telling them, okay, you've got these 3 more left. The next one, if you want to do this one, this is that much out of pocket. And they would have booked again and again and again. That was a strategy. It had a good booking rate, high conversion rate, and I could see that it helps the patient to the way that you help it. You're like kind of consulting them there and helping them plan their oral health care. That was my trick, and not trick, I mean skill, or one way of helping people at the same time getting them, patient retention. Rather than them getting a huge treatment plan with thousands of dollars in quotation, and they just go home, leave it there, and don't ever check or bother booking any appointment until next checkup that they have, and God knows what you're gonna do next time in order to help them book or not. So, and the conditions might have got worse by then. So that was a tip. I keep saying trick. Yeah, I don't know why. It's a tip. It's a skill. It's a way that is both way, helping for patient retention, at the same time helping the patients as well to break it down, make it easier for them. So that was what I was doing. It was working really well. Like, booking rate was really high, and I could see the patients appreciate that, helping them, breaking it down, making it easy for them to plan their treatment plan. And even financially, it was so doable and affordable then when you do it that way. Looking forward to Wednesday. Go and see patients directly. Go play around with booking systems and all that again. Maybe I'll look into their CRMs and PMS a little bit, see what they're doing. I might interview Dr. Lavon as well. Her name is Lavon. They're in Doncaster, Melbourne. Might interview her. She's so much into business growth. I learned so much from them because they were so much into business growth, going to different training courses and always on top of technology and practice growth and all that. And I really liked that, the way they were operating, and I learned so much from them. So I might interview her a little bit for my Dental Profit Machine podcast, and put it up in Dental Profit Machine podcast, interview her on sharing some of her tips and advices on practice growth and patient retention, case acceptance, and high value dental patients for high value dental services, those kind of things, and yeah, hopefully it would be good. Keep an eye on my post for if I release any interview for that, and I might post a few things about what I'm going to do around the dental practice there, and a few photos or videos. Maybe it'll be fun. I love it. It's really cool. Dentistry is fun. I always loved it, and yeah, let's do it.